Hey guys, it's Dr. May. How are you? All right, I hope you're having a good day. Today we're going to talk about not a coping skill necessarily, but an important tool that is often used in individual therapy, part of DBT. And if you're in DBT individual therapy, most likely you've been asked to fill out a diary card. So I want to tell you all about what they're used for and how they help so that you can understand this process a little bit better, okay? So let's get this screen going. Okay. All right. So diary cards. All right. So there's a lot of different diary cards out there, different versions of them. They have some in the manual, if you have the manual. But if you look on the internet and you look up diary cards, all different kinds of stuff come out if you do like a Google image search. And they have specialized ones for things like substance abuse, eating disorders, PTSD, all kinds of stuff. So the important thing is that you find a diary card that feels right for you, so that you feel like it's relevant to you and your issues, and it makes sense that you're doing that particular one. And if you're not comfortable with it, I'm going to show you how to personalize a diary card and to make it your own. All right. So let's go to this part. So sometimes I've heard mixed reviews about the fact that they are asked to do a diary card in therapy. And some people really struggle with it. It's not really their thing. They're not used to having to fill one out. And it really feels like an obligation. It feels like this thing that my therapist is making me do, but I don't really feel like doing it. And some people resist it, and they don't do it during the week, and they have to fill it out in the waiting room before the session, and they're trying to piece it together because they just don't particularly like it. So if you're one of those people that feel that way, that's okay. You're allowed to have your feelings about it. All right. But what I wanted to show you is how it also could be a helpful tool. And my hope is that if you understand, exactly how it's used and why we're asking you to do it, you'll feel more inspired to put effort into it and to really, own up to how it could help you and really try to use it in a way that feels more therapeutic for you. Okay. All right. So what are diary cards for? So if we look at the left, it's, what do they call, like a self-monitoring tool. So how do I monitor myself and then log that stuff on a chart? So instead of writing a diary entry like a journal, like writing paragraphs and stuff, all I'm going to do is to go down and check off certain things about my behavior, my urges, my emotions, and some events for the day, my skills, things like that. And it shouldn't really take too long, but it's just a matter of sitting down and doing it, okay? And the goal is that after you do that and you bring it to session, it can help you understand the links between all those factors and kind of give you some insight and self-awareness, like why do I do what I do and when I do it? So your target behaviors will feel like they don't just come out of nowhere. Like you'll see what's related to them and how, let's say your feelings are influencing the situation or certain events are influencing the situation, right? So it makes it like you become more aware of these things. And what people sometimes find is that if you fill out the diary card every day, then even during the day, when you don't have the card with you, you start to be a little bit more aware and maybe start to think like, you know what? I don't want to write down on my diary card that I did this target behavior. Maybe I should not do it. Or, you know what? I feel like I'm really angry. I'm probably going to have to put that on my diary card later, So it gets you to think more and be more mindful during the day instead of being as, automatic in your habits. So that's like a really important thing. It kind of trains your mind to, to look around during the day for what's actually happening. Okay, so it's really important too for communicating with your therapist, especially, it puts things into words that you normally may not put into words automatically, but because you had to fill it out on the diary card, you might end up talking about things you wouldn't have even thought to say. And it helps us because if you're doing it day by day, you're being more accurate about each day of the week. And it'll help you communicate better about what happened like a week ago than what you could remember just spontaneously right now, right? Like sometimes I barely remember what happened 2 days ago. How am I going to remember exactly what I was feeling and what went on a week ago, right? So if it's on the diary card, it's much easier for us to figure out what happened that day if there was something special about the day. All right, and also it can show evidence of your progress. So if you look at your diary cards over time, you might see like evidence that things are changing, right? Like, wow, I think I see that there's fewer target behaviors than I used to have, or my emotions are rated a little lower now. So I guess that's an improvement, right? And so it's you know, sometimes we don't recognize, we don't give ourselves props for the good stuff that's happening, but it's actually recorded on the diary card so we can see for ourselves, right? Okay, so this is the one that I use, okay? And you don't have to use it. Like I said, there's other ones available on the internet, but this is what it looks something like this. I have it saved in a Word file. And for each person I work with, I figure out, you know, what their target behaviors are, what their main issues are, and then I personalize it for that person, okay? And we could also amend it over time if necessary, but this way it feels like it addresses exactly what that person needs to address. All right, and I'm going to explain it more here. So I just took a slice of it, so there's more room, so I could blow it up a little bit. Okay, so the first thing I do is on the top I put a space for the dates. I didn't used to do this, but sometimes it became a little confusing, you know, which day was which, especially if the session's in the middle of the week, you know, and sometimes people, you know, kind of confuse days. So if you write the date in every day, it's a lot more clear. Okay. So the first part is urges. So urges to do whatever the target behaviors are that you've identified. And you rate them 0 to 5, 0 being no urge at all, and 5 being a really, really intense urge. So then the actions, all right? So those are the urges for the behaviors. The actions are the actual behaviors. So I try to list them in order of dangerousness or significance. So for example, let's say here, this person self-injures, and I might put that as number 1 because that's the most physically dangerous thing. Maybe I put aggressive behavior next because getting into fights is also possibly physically problematic. Then maybe substance abuse. And then maybe after that person has eating disorder issues, maybe purging after that. But it really also depends on the person. Like for some people, purging might be a really significant issue. That would be number 2. Whereas aggressive behavior might be more verbal aggression. It's not a big deal. Maybe that's number 4. Right? So it's really a person-to-person kind of thing, but you don't have to be too perfectionistic about this part. Other things you could do is, let's say the person self-injures in a few different ways. So you might have a few categories for that, right? Maybe taking pills and trying to overdose is one thing, and cutting is another thing, and burning is another thing, all right? Or scratching is another thing. It might have different significance, or you could leave it as one thing and just say specify. So when you're filling out a certain day, just say what kind of self-injury you did so you can communicate that with your therapist. Same thing with substance abuse. Sometimes I've seen substance abuse diary cards online, and there's a few different categories depending on the drug or the alcohol you're using, so you could track exactly what happened. Otherwise, if it's less of an issue, maybe you could just jot it down for each day. Okay. Certain things in actions are a little harder to quantify. So let's say you have an issue with restricting food. So it's harder to say how many times if it's an absence of something, right? So that might be something you would rate 0 to 5, for example. Or sometimes people have wanted to put things like engaging in bad thoughts or something like that, entertaining bad thoughts or obsessive thoughts. And that's hard to quantify. But maybe you could rate that also, like how bad was it that day from your point of view. Okay, the emotion section, I generally leave the same for people because it's pretty much core emotions that everybody experiences. Although once in a while, if somebody has a different emotion that's very prominent, such as loneliness, we might stick that in also. But it's important to rate negative as well as positive emotions such as joy, because it might mean something if you had more joy in a certain day, right? Okay, I also leave a section for what I call noteworthy events, positive or negative. So if you were to reflect back in the day, like what's some of the main things that happened that day that's important based on the other ratings you're filling in. So if it was some negative event, maybe that impacted the urges or the actions you had or the emotions you had. It was something positive that also could have a very big effect. But just a couple of words. It doesn't have to be a big deal. But if you really want to write about it, you certainly could do it on another piece of paper or a journal or whatever. Coping skills. Sometimes people like to fill out a check sheet with all the DBT skills on it, like the original diary card has something like that. But what I found is sometimes people either over-endorse or under-endorse. So people who haven't learned about most of the skills may not even know what they're filling out. It might leave it blank. Other people might check a whole bunch of things, and then by the time they come to session, they don't remember exactly what that looked like for them. I'll say, oh, I see you did self-soothe. What did you do that day? I'll say, I don't know. I guess I self-soothe, but I don't remember what I did, right? So when you leave a space at the bottom like this, I would want to know in your own words what you actually did to cope. So maybe you'll say, I took a warm bath. And that's what you meant by self-soothe. But because you wrote exactly what it was, you'll remember it when we meet for session, okay? But that's really important too, because we want to know if you're trying and what you're trying and what works and what doesn't work. So if you put it day by day, we could help track that as well. Okay, now I'm going to show you a sample, all right, just so you can see how all these pieces move together. And I'm going to show you 3 different kinds of days and what we can gain from a diary card looking at these different days. So let's look at Sunday, which I highlighted. So let's say this person, and I made these up by the way, all right, had really strong urges, right? So 5 is the highest. 2 of the urges are 5, right? Suicidal urges is 4, and urge to use and urge to purge are 3, kind of medium, right? But overall, some strong urges there. So then we look at the actions. So a few of those urges translated into an action, right? So the person said yes for cutting, yes for hitting a wall and cursing, right? So that's an aggressive action, and yes for purging ×2. So something big was going on that day, right? And I would want to know in session, well, what is it that happened? So under noteworthy events, argument with mom on the phone. So I would want to find out from that person, what is it about that argument that really got to you, And emotions too. So joy is really low, it's a 1, but the other emotions are really intense. Fear, misery, sadness, anger, and shame or guilt. So maybe that argument led to all those other reactions, urges, and behaviors. And I want to know how this all interacted and how they, what we need to do differently the next time. So I could see the person attempted to use some skills, listen to music, and maybe it was an attempt, but given the intensity of the situation, it wasn't enough, right? So listening to music wasn't enough to prevent the behaviors. So perhaps we would start discussing about, well, is there maybe some different skills you could try the next time? Maybe is this something that could be a little more effective that we could add into the mix that would change the outcome? All right, so this is an example of maybe a really difficult day. So let's look at Monday. So Monday, this person has kind of, medium to high urges, so sort of high in the suicidal, self-injury, and fighting urges, a little lower on urge to use and urge to purge, kind of low to medium. But if you look at the actions, the person did say yes for aggression, put nasty text, maybe, got a little angry, sent something they shouldn't have sent. But maybe it's not as bad as some other physical aggression the person had. So that's why it's important to specify. So punching somebody isn't as bad as sending a nasty text, although we still would want to work on that. But the good part is that despite those fairly high urges, there was no self-injury. There was no substance abuse or purging. So something maybe went a little bit better, right? Let's look at the emotions. All right, so kind of medium levels, maybe not as intense as the day before, but still, misery, sadness, and anger were 4s. That's still fairly high. And some of the other ones, fear, anxiety, shame, and guilt, are 3, which is kind of medium. All right, so despite some of those, intense emotions, the person did pretty well. So noteworthy events. So maybe what triggered all this? Friends canceled plans last minute, right? So we got to figure out what is it about that led to this chain of events. And another thing that's important here is the person listed 4 different coping skills. So maybe the friends canceled last minute. They did feel strong urges. They did feel intense emotions, but they tried things such as self-soothe, exercise, wise mind, and coloring, right? And I want to know exactly how those coping skills were implemented and, what was helpful about them, because they obviously did something because the actions were different this time. All right, so that's an important discussion to have on Monday. So let's look at Tuesday. All right, so Tuesday seems like a pretty good day. The person's urges overall were fairly low, much lower than the other days. There were no target behaviors, which is great. So we definitely want to figure out what worked, right? Joy is rated a 4. Wow, that's a lot different from the other days, right? Other emotions were fairly low, 1 to 2. So what was a noteworthy event? Maybe something was inspiring some of this improvement, right? Hung out with cousins, walked on the boardwalk. So maybe we could figure that out. Well, maybe the cousins are supportive, they're fun to hang out with, maybe the exercise, the fresh air was really good. And if that's good, how can we maybe do more of that kind of stuff? Maybe that's helping your day go better, right? And also coping skills, the person put exercise and mindfulness. So maybe that had to do with something that was going on while walking on the boardwalk, but I certainly would ask the person. Okay, so we want to figure out what happened on the bad days, as well as what happened on the good days. And that's how diary cards could help, all right? Another thing I want to bring up is that some people who are not willing or able to do a diary card for whatever the reason, and we still want to monitor behavior if there's active behaviors going on. An option, if you're the therapist, is to give the parent, if it's a parent of a teen, or a staff, if it's a person in inpatient, or maybe someone in a residence, give them a behavior checklist for the person with the main target behaviors that they can be aware of. Now, this happened to be one that I gave to the parent of a girl who I think was in her teens. I don't really remember this person, and I also changed the name for this purpose. But those were actually the behaviors that were on the list, okay? So an outsider could observe these things, and maybe perhaps some noteworthy events that they're aware of that may have corresponded with those things that day. And coping skills would be like if they know of coping skills their kid did, but you can't always know what the person's thinking, right? So they may have done something mentally, like think of consequences that the rater isn't aware of, but at least they could try to report what they observed, okay? And also note here that I didn't put a section for emotions. While you could kind of guess somebody's emotions sometimes, you can't always get in somebody's head and determine how they're feeling. So I wouldn't necessarily put emotions unless, you know, a noteworthy event is the person was yelling and screaming, seemed really angry or something to that effect. Okay, but that could always be discussed in session. But it's really important to have this tool, as you could see earlier. Sorry, that's my phone in the background. But anyway, sorry, I'm a little distracted. So, so this is just an alternative if you need it. All right, so some tips and suggestions. So if you're the one filling out the diary card, I would try to fill it out every evening at the same time. So this way, it's fresh in your mind, you can reflect on the day, and you don't have to try to piece it together the day of your session, which may be really hard to do, as we talked about earlier. Expect that when you do come to session that the behaviors will be addressed in order of priority or in order of dangerousness, because we want to make sure first that you're okay. You know, the most important thing is that you're alive, that you're not physically harming yourself or others. So, for example, on the sample we did, I would start with Sunday because that was the hardest day. And then after Sunday's taken care of, I would look at some of the other days, you know, and if there's a lot of things that are troublesome during the week, sometimes they interconnect and sometimes they don't, but I would try to generally address it in order of priority. And if there happens to be no target behaviors during the week and it was a good week, there's much more freedom about what we could talk about. You know, maybe there's other things that come up that are on your mind, and, you know, we can have a little more freedom in discussing that and maybe some other skillful things. Okay, another thing is, for those of you who are tech savvy, they do have DBT apps and DBT apps with diary cards on them. Now, because I work inpatient right now and I haven't done private practice for about 5 years, I'm not as familiar with that, but some of you out there might be, and I'd love to hear from you about how you've been doing with those apps and how they're helpful to you. But it might be worth checking out. Just download it and see if it works. And maybe there's even some kind of capability where you could kind of communicate it to your therapist and have them see what you entered or something like that. But I don't want to guess. I don't want to guess wrong because I haven't really done it. Another thing I would say too is, you know, if you're not sure, you know, if the diary card you have that you're using in therapy is helpful, ask to see if you could revise it. Just communicate with your therapist about it, right? Or, you know, if you want help changing it, ask for help. Or if you're forgetting why you need the diary card, either watch this video again or ask your therapist, like, how they think it'll help you. Okay, so you could be assertive about it. Use your dear man skills, right? Self-respect, like figure out how is this helping me? Like, how can I look out for myself in this therapeutic process? And also, like I said earlier, feel free to save your diary card so you could look back and really see your progress on paper. You know, sometimes as a therapist, I would collect a person's diary cards, but you as a client could collect them too. You know, make a copy first before you give it to your therapist so you could see, right? That'll empower you to look at your patterns yourself. Okay? All right, so that's my little spiel about diary cards. I hope that helped you understand them better and see how they work. So hope you give it a try on your own, even if you're not in therapy. You know, there's some value to monitoring your own behavior just personally, and it gives you some insight. Okay, guys, so stay tuned for the next video about behavior chain analysis, which kind of springboards from diary cards. All right, so thanks for listening, and I'll see you in the next video. Bye.